What's going on, everyone? Happy Friday. Hopefully everyone is doing well, staying safe, healthy, just having a great day so far. If you had to take a COVID test, flu test, or a test for any other virus, I hope you have tested negative. If you did test positive for any of the viruses, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Friday edition of the Virus Update for Friday, February 28th, 2025. That's right. We're almost into March already. Can you believe it? If you are new to my channel, welcome to my channel. This is where I do the daily virus update. Yes, a video that is done every day on all those viruses that can make us sick. You know, all the latest news, data, and everything else in between. And let me tell you, there's a lot of that today. You're going to see a lot of different news stories. You're going to learn about a new COVID variant. You're going to learn about measles. You're going to learn about several different things, all to keep you safe and informed of what's going on. Want to follow along with me while I report this each and every day? Just subscribe down below. If you like this video, give it a thumbs up. Let's try for 200 like button hits today. Share this video with anyone you know. And of course, leave your comments down below. Already, we do have a ton of things to get through today. As stated, this video is definitely going over 20 minutes today. I hope we don't have to go over 25 minutes, but there's a lot of things to talk about today. So starting off with measles. The outbreak in Texas continues to grow. It's approaching 150 cases. It's now at 146. And as you know, if you've been following this, or even just watching the news on TV, because they have been on this, there is the death of an unvaccinated child this week. So, yeah, the situation continues to get worse in Texas. And I don't think we're done with this yet. I think it will pass 150. The question is, will it pass 200 cases? It very well could, because no one wants to take this serious. No one at the federal level wants to get serious with this. So because of that, things just continue to get worse. Now taking a look at this. In Washington State, King County, an infant diagnosed with measles. And yes, this is the first case for Washington, this state. It's the first in-state case this week. And there are multiple public exposures being listed with this one. So yes, this is not good. This was a baby, and they said the baby was possibly exposed during recent travel, but it looks like he tested positive in Kings County. So this is something that we have to keep our eyes on. Moving on to this. In Hawaii, hospitals are just being overwhelmed with patients as flu cases are just still soaring there. Most states are starting to do better. Not perfect. We got a long ways to go, but Hawaii right now is just getting slammed. And if you recall, Hawaii was a little bit later to get going with the surge based on news reports that we have seen. So, yeah, Hawaii not doing well for flu at this time. And it also says here that we are seeing on average about 100 patients a day more in January and February than we were seeing in December and November. This is one of the hospitals there, and it does say here some of the hospitals are not just overwhelming or full. Many are operating over capacity, particularly in Honolulu. Yeah, that is not good. Speaking of flu, Justin Timberlake has canceled a Columbus concert due to flu. Yet again, he's having a health issue. He had health issues in the past, but this time it's a virus. He has flu. Moving on to this. Back to Washington again. Second wave of seasonal flu hits Washington hospitals and fills ERs. Yes, the hospitals up there in Washington, state of Washington, are very busy right now dealing with flu patients. Flu has been really bad this year. It's actually been worse than COVID in many places. And look at this. CDC says 13% of kids who died from flu this year had brain damage. Yikes. That's not good, but I mean, it can happen with flu. Doesn't always happen. It's rare when it does happen, but because we are seeing so many cases this year in the United States, it is something that is occurring this year. Up in Canada, in Ontario, a COVID outbreak has been declared at St. Joseph's General Hospital in Elliott Lake. Noticing a theme here lately? We're seeing not only more famous positives, we're starting to see the return of COVID outbreaks. I think on a global scale, there's a little bit more COVID activity right now. Could be because of that new LP 8.1 variant that continues. It's not new at this point. It's been around for a while, but the fact it's growing in proportion size, that could be one of the reasons why that is happening. In New York, second case of bird flu identified in Monroe County by Health Department. Yes, there is another case up there, and it's been identified in a small backyard flock of birds in Monroe County. The Monroe County Health Department has announced. All right. Many people have asked me about this. We did mention this the other day, but we got to mention it again. And sometimes, maybe going forward, I'll repeat a couple stories here and there because some say, oh, you didn't mention such and such. I did. It's just we only spend short windows of time on each story because there's so many things to fit in these videos. And today is a great example of that. I got a ton to fit into just this 25-minute period. I don't want to make these videos go any longer. I mean, at one time we were 12 minutes and it was 15 and 20. You get the point. The videos, sometimes they just get too long and I can only fit so much stuff in. Well, take a look at this. Alarm grows as mystery illness in Congo has now killed 60 people and infected over 1,000 people. Yes, this virus continues to get worse. Hopefully we get some answers from the World Health Organization or someone soon. Let's just read the first part here. On Thursday, the World Health Organization, WHO, released their latest report on the worsening outbreak of unknown disease in two separate locations in the Democratic Republic of the Congo, DRC, noting that 1,096 people have now officially been infected and 60 have died. And remember, the last time we saw a report, we're hearing that the time from being positive to the time some of these people that have died is not all that, it's not spaced all that far apart. So obviously a concerning situation, and we're going to have to continue to keep an eye on that because it's something that's not good whatsoever. Report, COVID survivors nearly twice as likely to have ongoing symptoms as those with the flu. Yeah, to all those people that say, oh, well, COVID is just a flu. Okay, but with COVID, you're twice as likely to go on to have worsening symptoms or ongoing symptoms that could become worse, I should say. That not worsening symptoms, but more so ongoing symptoms that could just continue on. So, yeah, COVID is not always the flu, but I will say this. When it comes to COVID and flu, there are a lot of symptoms when you get the initial infection, when you test positive. There are a lot of symptoms that are the same. It's just COVID. It's more likely to go on to cause you to have continuing symptoms or symptoms that could get worse or a whole bunch of different things that could happen. So, yeah, not good to see that. A reminder, my website is datareport.info, loaded with information. We do have studies. I just added another one this morning and a whole bunch of different things. There's a COVID positive archive. Eventually, I will get caught up on that. Probably never will, but we'll see. You can find out all kinds of information here, and there are several tracking threads, including we have the measles tracking thread, sports illness international, sports illness, H5N1, school illness, on and on I could go. Taking a look at what's going on in Canada. Let's refresh this. And it looks like the viral activity levels in Canada today are updated. COVID-19 is moderate, flu A is high, flu B is moderate, and RSV is listed high at this time. In case you did not see yesterday's update, COVID-19 in the UK did go up ever so slightly, 4.4%, went up by 37 to 870 cases. Now, they're not doing a lot of cases, but some of those cases could be missed because of these at-home tests or just simply people not testing at all. Oh, it's just a cold, it's just that. Well, COVID can be a lot of things. Sometimes it is minor or asymptomatic for some people, and sometimes a perfectly healthy person gets a severe case of COVID. It does happen that way. Deaths went down slightly, but that hasn't really updated. The healthcare, that hasn't updated recently, so I don't know why that keeps saying January 31st. I would like to think there has been an update since then, but honestly, I just do not know. So that's the latest on the UK. Let's take a look at what is going on with air qualities around the United States, and you're going to see there are some areas having bad air qualities, especially on the West Coast, but when we go mileage-wise, a large portion of the country is doing really well today. We do have a little bit of bad air qualities in Oklahoma and Arkansas, and we'll say central to southern Florida. But look at that. The rest of the East Coast, the Northeast, the Great Lakes aside from north of Lake Erie. He's doing really well today. It's the West Coast that's having the worst of the air quality. In Pinellas County, Florida, we can see here several sick person calls at this time. 1, 2, 3, 4, 5, 6 of them right now, and some other things going on at this time as well. Let's find out what happened in Philadelphia yesterday, shall we? And it looks like on Thursday there were 790 EMS incidents reported. And speaking of Philadelphia, we finally got new flu data in from Philadelphia. I know it took all week, but here we go. Good news. Influenza in Philadelphia County, Pennsylvania continues to drop. This includes the city of Philadelphia. And you can see here, number of flu diagnoses in the last week. It is in between 600 and 700 at this time. Taking a look at influenza A, that was, between, we'll say around closer to 700 at this time. And then taking a look at what's going on with influenza B, and that was under 50 new cases for that. Taking a look at the positivity rate, we can see here laboratory-based surveillance for influenza. It's still up there at 25% positivity rate. So that is still really high at this time. And that diagnosis number, I want to go back to that real quickly. That diagnosis number, that was the number of people diagnosed in the hospitals. So it is still near 600. That is still pretty high, but hey, at least it is starting to come down. In Montgomery County, Pennsylvania, we do see there are some calls right now. 15 of them, and 4 of those calls are for respiratory emergency at the moment. Not a good thing there. Let's see what's going on in Chester County, Pennsylvania. And wow, busy there. We're seeing sick person 1, 2, 3, 4, I think 5 sick person calls right now. Multiple respiratory calls. Yeah, busy afternoon in Chester County, Pennsylvania. A lot of people are still sick. Taking a look at what's going on with the hospital situation. Sometimes the hospitals get busy again on Fridays after maybe a midweek lull. You can see York, Pennsylvania. There is a hospital that is yellow, and look at that. This just updated on us. Completely refreshed. Wasn't certain if that was new or not, but yeah, there's still more hospitals stay in southeast Pennsylvania yellow than yesterday. Same with the Lehigh Valley, although that looks a little bit better. And now we do have a hospital overcrowding in the Poconos of Pennsylvania, Monroe, St. Luke's campus, Monroe County, and we do have a few other hospitals having problems at this time. Let's see what's going on in New Jersey, and hopefully some good news there. And look at this. Yes, HMH JFK University Hospital is on a patient volume issue. But look, Princeton Hospital, Penn Princeton Medical Center. It's not listed today. About time they have a day where they're not dealing with big issues there, because as you know, almost every day this week they have had problems at that hospital. In New York State, 1,137 new cases. And you can see, it went up a little bit slightly again. This average chart, a little bit of a bowing upward. Not a good thing to see that. Take a look at this. And you know what? Let's do the statewide hospitalizations first. Take a look at this. Statewide hospitalizations, a little bit higher than where they started the week. Down from yesterday, though. 793 people in hospital and 72 people in the ICU at this time. But now take a look at New York City. This is what I want to show you here. Yeah, New York City hospitalizations, once again, have hit a new winter high. 344 people in the hospital, 36 people in the ICU. Not certain what's going on there. Could be because of the LP 8.1 variant. It is possible that that is what's going on there. In Chicago, influenza emergency department visits are moderate. RSV is low at this time. And COVID-19 emergency department visits, they're low and flat. Neither of those are dropping or rising, although influenza is dropping at this time. Influenza positivity rate, still 15%, but it is going down. RSV positivity rate, 3.1%, going down. 4.9% for COVID, and that is dropping there. Moderate influenza A activity, RSV activity, and COVID-19 activity in Chicago at this time. All right, before we continue on, I want to remind you, let's hydrate. Let's take a hydration break before we go on and read some data from CJS. Doesn't that make you feel better? Good to hydrate, because we got quite a bit of stuff to read here too. Here we go. And before that, I did put a note here. What was the note I added in today? The virus update will continue as normal over the weekend with whatever news and data there is. Sunday will feature the Sunday Wastewater Update, unless it's an unexpected busy news day. And as you know, on Sundays, I try and dedicate at least half the video to wastewater. Last weekend, we weren't able to do that. We had to do some catch-up because we had that pre-recorded video for Saturday. But yes, the virus update, it will continue this weekend. And you know what? Start letting me know in the comment section down below. Which wastewater sites do you want to see on Sunday? On Wastewater Scan, or it could be the CDC. Let me know. And I will maybe keep a list of those, and I will make sure we get to those wastewater sites, or as many of them as we can. And alrighty, let's move on to some data from CJS 83172. And first off, some numbers from Wednesday. Some are daily, some are weekly. Daily for Florida was 565 new cases. This is all for COVID now. 565 new cases and 9 new deaths. New York daily 737 new cases on Wednesday. Puerto Rico daily 197 cases. Delaware a weekly number 194 new cases. Nevada weekly 261 new cases. Oregon weekly 12 new deaths. South Dakota weekly 233 new cases and 6 new deaths. Washington weekly 411 emergency department visits and another 7 deaths. And Thursday, which was yesterday, select numbers. He says he may also include these in the first of a double posting on Friday. Of course, when he does post Fridays, we'll get to that in tomorrow's video like we've been doing lately. That'll probably take up several minutes of the video, which is good because, hey, we need to know this data, and I'm so happy that he provides it to us. Thursday, number for Florida was 531 new cases, 11 new deaths. New Jersey, 1,061 new cases. That seems like a high one-day number. New cases and 6 new deaths in a 2-day update. There you go. It's a 2-day update. New York, 1,367 new cases, as I stated. Puerto Rico, 161 new cases and 2 new deaths. Alrighty, moving on now. We do have some new CDC data. Let's start off with this. Percentage of emergency department visits diagnosed with COVID. Take a look at the chart here. It is continuing to drop at this time. Yes, this is some really good news. It's still dropping. No signs from the emergency department perspective that the United States is headed towards a new wave yet. So that is some really good news. Taking a look at what is going on with hospital capacity, this did update today, and we can see here it actually improved a little bit. 75.8% of all beds in the United States are being used today, and we can also see here when it comes to the ICU, 73.9% are being used. Wastewater Scan, going to save that for the weekend. Maybe we get to that tomorrow. Maybe it's Sunday that we do that during Wastewater Sunday. So we're going to skip over that for today. But I will show you this. The national trend for wastewater from the CDC is continuing to drop at this time. Take a look at this. As of February 22nd, it is still dropping. You can see here this map has improved. Again, we'll get to more of this over the weekend. When we take a look at the national and regional levels here, let's adjust this. We can see here that all regions of the United States for COVID at this time are dropping. Influenza A at this time, what's going on with that? It is listed high, and it is still dropping. And when we take a look at what's going on with RSV, let's see here, what's that doing? It's still dropping. Maybe not dropping as fast, but hey, it is still dropping, and it is in the low category at this time. Taking a look at this, drum roll please, and let's refresh this because it's doing a refresh on us. The new update from the CDC for COVID variant. Now, mind you, it looks like there's only one region of the United States. It looks like Long Island, New Jersey region is the only region that's updating for this, and there's some others that's included in that, but that is really the only region that's updating. I think Puerto Rico is in that region as well. So, yeah, limited data, but it's a trend that I think we saw coming here, that LP.8.1 was going to continue to grow. It did. It's now listed at 42%. And mind you, these are only estimates. We don't know what's going on in the rest of the country. We're basically in the dark with other parts of the country. We do know Pennsylvania from wastewater, LP.8.1 did already take over. So it's at 42%. XEC is at 31%. Yeah, LP.8.1. Now the new dominating variant in the United States. And with that, let's just go back to something for a second here. It's taken over, and we're not seeing a rise in the emergency departments just yet. That's some good news, but I express extreme caution. I think eventually that's going to change. Mind you, Easter is late this year. A lot of the school kids are going to be, we'll say high school, or middle school, grade school, are going to be going on spring break probably in April this year. They're not going to be going early because Easter is delayed. But the college students in March will be going on break. We're going to be keeping an eye on places like Puerto Rico. I mean, sometimes they do get a spring wave. Florida, anywhere where there's beaches down south. We're going to be keeping an eye on those areas where spring break activity will occur. And those are areas we do have to watch for an increase in COVID and maybe even another rise for flu in those areas, more so concerned with COVID. So that's something we're going to keep an eye on. Speaking of flu, take a look at the influenza-like activity map. Yes, you're seeing a big improvement on this map. Now, we still do have purple, which is the highest level of bad in the state of Maine, in the state of New Hampshire, Massachusetts. We could only guess that Vermont would still be very high. There's no data here from Vermont, so I can't tell you whether it actually is or not, but my guess would be it's at least, it's at the very minimum. It's probably still high to very high, but then again, New York State is down into the moderate category. Yeah, big drop for New York State. Still purple in Ohio and Michigan. Ohio has been going purple for several weeks now. Really bad. I mean, take a look at this. There's the previous week. There's this week. Even improvements in the northern plains. The southeast is improving. Still some work to be done on the west coast. We still have high in California, very high in Washington and Oregon at this time. We also have New Mexico that's still very high in Nebraska. You get the point here. It's still high and very high in many places, but we're starting to see some light from this long, dark, very sick winter that we have dealt with here in the United States. And that, my friends, is some good news. Taking a look at what's going on with epidemic trends. Don't know why it's in the growing phase for COVID in Texas. Now, I'm uncertain as to what is really going on there. Likely growing in Tennessee, likely growing in Alaska at this time. And then many states are declining, likely declining, or just not changing at all. And some of them are not even estimated. For flu, we do have a little bit of a problem here. Growing epidemic status in portions of Tennessee, Mississippi, and Alabama. Again, not sure why those areas are just randomly in a growing phase. Likely growing in Texas and Alaska, and then all the Northeast is now declining. So those states that are still in the purple, you may come out of that next week. Let's take a look here for a second. Let's go back to Texas, and let's go back to the influenza-like illness map, and let's just rewind this for a second. No, we don't want to zoom in. Let's just rewind this. And yeah, see, Texas, things have improved, as have Mississippi and Alabama and Tennessee. So while they're improving, the epidemic status actually is still listed at growing in 3 of those states and likely growing for Texas. Not understanding why that is. Alrighty, folks, that does it for the Friday edition of the virus update. We'll have another virus update again tomorrow. I can already tell you tomorrow is probably going to be another busy day. We're going to take a look at some more of those emergency department visits diagnosed with COVID. We'll go state by state, maybe some more hospital capacity, and whatever news of the day pops up, and hopefully maybe some international data as well. If you enjoyed this update, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, and leave your comments down below. I will see you all again next time. Until I see you again next time, have a fantastic Friday evening, weekend, and thanks for watching.